Welcome, and thank you for joining our discussion about COVID-19 vaccines for young people. I'm Betty Hart. I've worked in facilitation for over 20 years. Some of my favorite subject areas include stress management, laughter as wellness, cultural sensitivity, conflict resolution, and care equity, which includes how poverty, bias, and race affect health outcomes and employee productivity. I'm interested in helping communities connect through conversation, like the one we're about to have. As vaccine availability has expanded to youth ages 12 to 17, we understand that many parents have questions about COVID-19 vaccines for their children as we reopen and return to in-person learning. We're joined today by Dr. David Bronstein to answer these questions. Welcome, Dr. Bronstein.
Thank you, Betty. It's great to be here with you today.
Thank you. I know you wear many hats in your work with Kaiser Permanente. Before we get started, please feel free to tell us a little bit more about yourself.
So, I'm a pediatric infectious disease specialist, but I'm also a general pediatrician with Kaiser Permanente in Southern California. In addition to that, though, I'm also a father. I've got two kids of my own, a 13-year-old daughter and a 10-year-old son. So, all the conversations we'll be having about vaccinations of kids, trust me, that hits very close to home.
Thank you so much. And we appreciate hearing about your personal story with your kids. I'd love to open the conversation by asking, what's most important for parents and families to know as we plan for the months ahead?
So I don't want to be the doom and gloom guy, but I will. The pandemic is not over yet. The virus is still here. And even though it feels like everything's opening back up again and life is going back to normal, the virus really hasn't gone anywhere. And now we're on the verge of seeing these new variants coming that are more transmissible and more deadly. And we really need to make sure that we're doing everything we can to protect ourselves and the people we care about, especially our kids.
Thank you. Now I'd like to introduce Clarissa Leyoun. Clarissa, tell us a little bit about yourself.
Hi, yes, I'm a mother of two elementary school age children, grades 4 and 2nd. My husband is a San Diego deputy sheriff for the county of San Diego. So COVID has been a really hot topic lately in my household, as well as our school, because since I work at the school as a paraeducator, that issue has come up with the educators as well as like staff in terms of what's going on looking forward into the upcoming school year.
Thank you, Clarissa, for being here. Let's
Thank
get
you.
started. What's your first question?
So how do the COVID vaccines affect children? Are there any side effects that impact children and youth differently than adults?
So, in addition to the thousands of kids that were in the clinical trials, we now have information from the millions of kids who have gotten the vaccine already. And what we know is that kids do very well with the COVID vaccine. Any of the side effects that the adults have, we can see that with kids too. And for the most part, they're very mild. So kids may complain that they have a sore arm the next day. After the second dose, especially, sometimes you have a little bit of fatigue, sometimes a little fever or chills. That's all totally normal. And for the most part, it's very mild and it goes away within a day or two. And oftentimes kids have less side effects than the adults do. I know for my daughter, after her second dose, she was fine the next day. I was miserable after I got mine just for a day or so. So maybe I'm just weak, but it sure sounds like, talking to a lot of the kids I've talked to, they seem to be doing better even than the adults are doing in terms of side effects.
Oh, okay. So we've heard of Moderna, Pfizer, and Johnson and Johnson vaccines for the adults. What do we have any preferred option or any of those three for the children or for the youth?
Right now, we only have one option. So it's not, unfortunately, a menu where you can choose which one you want. The only vaccine that's been given authorization for kids 12 through 17 is the Pfizer vaccine. Now, there are studies underway on younger kids. There are studies on the other vaccines that look at their safety in this age group as well. And Moderna has filed for emergency use authorization, but they haven't heard back yet. So for now, it's just Pfizer, and it's a wonderful vaccine. It's incredibly effective and incredibly safe.
Okay. And how long will the vaccine be provide protection? Will there be any boosters needed in the future?
That's a hard question to answer. We just don't know the answer to that. If it was up to the pharmaceutical companies, of course, they'd love to have lots of boosters, but we don't go based on what they want. We go based on where the science is. And the reality is the vaccines have been available for less than a year, even for people in the studies. So we just don't know exactly how long they'll last long term. But right now, it looks like they will last for a significant amount of time. When you look at antibody levels in people who have had the vaccine, these vaccines seem to be going strong for, it should be over a year based on the projections. In addition, we're not seeing breakthrough cases. The amount of breakthrough cases is a fraction of a percent right now, meaning that the vaccines work and continue to work for long periods of time. The other thing, too, to think about when you think about will we need a booster or not is will the virus change enough that the vaccine won't be as effective? So you talk about the variants, the Delta variant, for example, which is becoming more and more common. And the great news is that the vaccines we currently have in their current formulation are very effective even against the variants. So it doesn't look like we would even need to change it up to cover different variants or mutations in the future. But time will tell. If it looks like immunity is wearing off, absolutely, we may need to get a booster when that time comes. Maybe something like the annual flu vaccine, but the reality is nobody knows right now for sure.
Okay. Are there any long-term implications or impact from the COVID and immunizations?
So that's really two different questions. Can COVID have long-term implications? Absolutely. Can the vaccine? Doesn't look like it. So COVID itself, unfortunately, the scary thing about COVID is not just the acute infection that puts you in the hospital and awful things can happen, but there's a huge number of people, including kids. It's estimated there's hundreds of thousands of kids even who have had COVID and then continue to have symptoms from that, whether it's fatigue or things that are more severe for even over 2 months, what we call the long haulers. So COVID can definitely have a long-term impact, especially on a kid's life so far, which is concerning. The vaccine itself, vaccines in general, there really is no vaccine out there that has shown to have side effects that pop up anywhere after usually 6 weeks after the vaccine. So long-term impacts from a vaccine or these side effects that may pop up sometime later, that's really not something that we see. Right now, I know there's a lot of people talking about those mild cases of heart inflammation or myocarditis that may or may not be associated with the second dose of the vaccine in some young adults and some older kids. Even that happens within a few days of the vaccine, and the vast majority of those cases resolve almost immediately with just some Motrin, basically over-the-counter medication. So it doesn't look severe at all. It's not having long-lasting impacts on kids' health.
Thank you both. I'd like to move the conversation to families with younger children, and we have a video submission from a parent to kick us off.
Hello, my name is Marina Simmons. I am a mother of two, a 14-year-old daughter and a 5-year-old son. My daughter keeps begging to go to sleepover with her friends. I know the parents are vaccinated, but I keep telling her that she cannot go until she and her friends are vaccinated. Is that correct? Also, I have a 5-year-old son. Do I need to wait for him to be vaccinated in order for her to be able to go to her sleepover? That is my question. Thank you.
That's a great question. Yeah. It's a question that I myself heard at home as well. My kids asking the same thing, both my 13-year-old before she was vaccinated and now my 10-year-old since he's not able to get it. So trust me, I absolutely understand. I think what we need to remember is that all the rules and all the recommendations and the guidelines about reopening society again and doing things closely with other people without masks on, those refer to people who are fully vaccinated. Okay. If you're going to be in close contact with people who aren't fully vaccinated, you need to continue wearing the mask. And so For your 14-year-old daughter, the best solution for her is get her the vaccine. And then 2 weeks after her final dose in the series, she would be free to get together with hopefully also vaccinated friends at that time. And they can go back to pre-pandemic life, which for a teenager, my God, that's just so important that, they get their life back in order, because there's so many kids out there with issues with depression and anxiety and everything else that the pandemic's caused. The best way to get them back to normal, get the vaccine. For your 5-year-old, I'm going to be doom and gloom guy again. I can't recommend that he gets together with other similarly aged kids who also, by definition, because of their age, haven't had the opportunity to get the vaccine. That's unfortunately a risk, and the recommendations say these things shouldn't happen. He can play outdoors with his friends, and even without a mask on outdoors, that's fine, but he shouldn't be prolonged periods of time without masking, in close contact with other people. It's risky, especially with these new variants that are looming large above us right now.
Thank you. I'm sure there's a lot of discussion among parents and school staff. Clarissa, what else are people talking about?
People are actually wondering if there's an increase in infections when students start returning to school in the spring. If not, why is it important to vaccinate youth when we were originally told that they were low risk?
Yeah, so that's another question there. When kids were going to school, some schools were open even during those holiday surges that we saw. And unfortunately, especially in high schools and especially in colleges, we did see outbreaks within the school setting. And those outbreaks even had impacts on the community as a whole, especially in some college towns with older folks who at that time didn't have the vaccine. It was quite dangerous, and young people, unfortunately, not following the rules they were supposed to. It was a very dangerous time. In spring, when a lot of other schools opened up on usually a limited basis and the kids were still taking precautions, there just wasn't as much COVID circulating. And so because of that, we didn't see a lot of school outbreaks, but we didn't see a lot of outbreaks anywhere at that time. The question right now, though, is as schools open up again, especially in the fall, especially for those younger grades where kids don't have the opportunity to get the vaccine yet, are they going to spread the virus? And it's a risk. It's very risky, especially again with the more transmissible and more dangerous Delta variant that probably will be the dominant strain in the US at that time. I think it's a misconception that kids don't need to worry about COVID, right? It's true. Younger kids don't seem to transmit it as much. Younger kids don't seem to be hospitalized and have as many complications as teenagers or adults do. But the reality is kids still can die from COVID. Hundreds of kids have lost their life to COVID in the United States. Tens of thousands of kids have been hospitalized from COVID, not to mention the kids who have had that multi-system inflammatory syndrome. There's been several thousand of those already. And those are kids that wind up in the ICU. It's really scary and tragic in some cases. And then, of course, there's kids with long-lasting implications from a long course of COVID, that long COVID that we talked about. And so kids can get sick with it too, not to mention who can they be bringing the virus home to if they get infected in a school setting. So I think it's fine for kids to be back in school. It's great for their mental health and wellness, but they need to continue to take those precautions because these are some very vulnerable pockets of people who can really spread the disease.
Okay, thank you so much for that. One parent has a son that has peanut allergy. Is there any data whether the vaccines are safe or if there's any additional risks for kids with allergies or immune compromised?
So the child with the peanut allergy can absolutely get the COVID vaccine. Not a problem there. The only person out of anyone who cannot get the COVID vaccine is if they have a severe allergy to a component of the COVID vaccine. So there's no peanuts in there, so you don't need to worry about that. But in the vaccine, the main thing that people theoretically could react to is something called polyethylene glycol. It's a component that's used in laxatives. So anyone out there who's had who's taken a laxative and had a severe allergic reaction to it, they should not get that specific COVID vaccine. Having said that, since a lot of people may be saying, wait, how do I know if I've never taken a laxative or I have no idea if I'm allergic to a component? We observe everybody. We observe everybody for 15 minutes after they get the vaccine. And in someone who has had a severe allergic reaction to anything before, maybe a peanut allergy or something else, we actually observe them a little bit longer, usually for 30 minutes, just to make sure that there's no sign of an immediate reaction. And if there is, we've got nurses standing by ready to do whatever it takes, whether it's Benadryl, epinephrine, fluids, whatever we need to. For the most part, though, a severe allergic reaction to any of the vaccines that are currently available is exceedingly rare. We're just not seeing much of that at all. It's more people who get themselves kind of worked up and excited about the vaccine, and then they feel a little faint afterwards. But you just sit down, you drink something, you'll be fine.
Oh, that's great to hear. Everyone is also wondering what to expect when students return to school in the fall. Will vaccines be required?
So that's a great question. I think for the most part here, a lot of schools actually have been having this discussion. A lot of high schools have had it, especially now that the vaccine is available for those who are, 12 and up. But especially colleges have been having that conversation. And right now, I think the vast majority of the schools, at least everything that I've heard, and this may change even, on a daily basis here, most schools are not going to require it until the vaccines have full authorization, full approval from the FDA, not just the emergency use authorization. That's just a matter of time, though. The Pfizer and Moderna already filed for that approval. It's just a matter of time before they get it. There's no reason why they wouldn't now that we've, quote unquote, tested the vaccine in hundreds of millions of people. So we know it's safe. We know it's effective. It's just a matter of time before they get the full approval. And then you will probably see people start mandating it. Now, for the younger kids, of course, the question is not, will it be mandated? The question is, can they actually get it? And we're still waiting on that. Hopefully by fall, we'll get results back from the clinical trials in kids all the way down to as young as 6 months of age. And then you can start seeing if schools are going to recommend and require the vaccine.
Okay, thank you so much. Parents are also wondering how to handle group activities back in school. We do have another video submission from Eric, who's specifically wondering about group sports.
Hello, my name is Eric Rudis, and I'm a retired United States Marine and a single father of 3 teenage boys, ages 16, 15, and 13. All my boys are involved in lacrosse, which is a contact sport, and they're vaccinated. My concern is there any risk to them playing with unvaccinated kids? That's my question.
So first of all, thank you for your service, and wow, raising 3 teenage boys on your own, good luck. That's awesome. So I'm not worried about your boys. I'm really not. They're fully vaccinated. I'm not worried because the numbers of breakthrough infections that we see are extremely small. Again, just a fraction of a percent. So safety-wise for them, playing outdoors without a mask on, that's fine. I am not worried about them one bit, even if they're playing with people who aren't fully vaccinated. I'm more worried about the other people who they're playing against or people on their team who haven't gotten the vaccine yet. And the important thing to remember is that for them, they still need to follow the guidelines. If you're not fully vaccinated, meaning 2 weeks after that second dose, you need to follow guidelines. And the CDC and the American Academy of Pediatrics have guidelines about playing sports, even outdoor sports. If you're with people for a prolonged amount of time within 3 feet of them, even outdoors, you want to wear a mask whenever possible, as long as it's safe to do so. In addition, they want to wear masks on the sideline. They should be wearing masks in the locker room. They should be wearing masks on the team bus if it's a school team, for example. So people who are not fully vaccinated, yes, there is still a risk of transmitting the virus, especially with these variants out there. But for those of us who have had the vaccine, that to me is the biggest benefit of getting the vaccine, that sense of relief, that sense of safety, that I can now do things that other people can't, and I'm going to be safe.
Okay. Thank you so much for answering these questions.
Dr. Bronstein, it looks like we have time for one more video submission. So let's hear from Kirsten from Georgia.
Hello, my name is Kirsten Nichols and I live in Georgia. I have a master's degree in public health and I am the proud mother of two young boys, a 7-month-old and a 5-year-old who will be going into kindergarten in the fall. Our family is currently divided on the topic of vaccinations and we're not sure how to handle family gatherings with our young sons with a mixed group of people who are both vaccinated and unvaccinated. And so my question is, what would you recommend? Should we wear masks in these gatherings or should we not wear masks? Thank you.
Yeah, another great question. Sure sounds like you've got your hands full as well. And I know that can be a source of contention. Even within my own family, we have some issues with some relatives who are vaccinated and others who haven't gotten around to it yet for one reason or another. And it becomes very confusing. If you look at the CDC guidelines, they recommend that a household who's fully vaccinated, it is okay for one additional unvaccinated family for them to get together, even in an indoor setting without masks, without distancing. In your case, though, that would be different, though, right? Because by definition, your household can't be fully vaccinated because your kids are too young. And if you're getting together with more than one household, and it sounds like you would be, you've got a number of people from different households who are unvaccinated coming together. Safest thing to do in those situations, first of all, would be stay outside as much as you can. And in an outdoor setting, if you're not really close to each other for prolonged periods of time, it is okay to not have the masks on. But for the most part, especially with the kids getting together in an indoor setting, the safest thing to do for everybody who hasn't yet gotten the vaccine is to continue to wear the mask and distance as much as possible. I know it's probably not the answer you want to hear, but we got to stay vigilant. We got to stay safe, especially knowing that so much of the country and the world as a whole is opening up again, letting our guard down. And we've got these variants and other strains that are on their way and already here in some cases. So err on the side of caution for right now, but as soon as the vaccine's available for all ages, get it for everyone who can possibly get it, and keep working on your relatives. Keep talking to them about your experience with the vaccine and how it's been fine for you and that sense of relief that you've gotten by getting it. Hopefully you'll start rubbing off on them as well.
We've covered a lot of ground today. I want to thank the parents, Clarissa, Marina, Eric, and Kirsten, and Dr. Bronstein for taking the time to engage in this dialogue. Conversations like this are not only an opportunity to share concerns and gather the information we need to make informed decisions about our health, but it's also an opportunity to increase our empathy and understanding for the complexity of this situation. If you're age 12 or older and haven't yet been vaccinated, you can text your zip code to 438829 to find a free vaccine near you. In many locations, no appointment is needed, and you can even get a free ride there and back with Lyft or Uber. Thank you for joining us, and have a good day.